John Wycoff from the Wycoff Wellness Center talks with us about hypothyroidism. And in previous discussions, we've talked about diagnosing it. We've talked about what it is. And now we're to treatment. What do we do about it?
A little bit about some of those common symptoms of low thyroid: fatigue, trouble losing weight, depressed mood, trouble sleeping, dry skin, constipation, insomnia, things like this. Then we talked about getting the right test, going beyond that simple TSH test and getting the full thyroid test and the thyroid antibodies. But after the diagnosis is made, then what do you do about it? How do you treat it? And there's really two things that we do at the Wycoff Wellness Center. One, we try to support thyroid function. You can do that with certain nutrients. Some very simple things like iodine. The mineral iodine is something that this part of the country we're very deficient in. So some iodine supplementation. Zinc and vitamin D3, critical for adequate thyroid hormone activation. But most people with low thyroid function need a prescription thyroid replacement. And most doctors prescribe a synthetic form of thyroid called Synthroid. And we really try to get more of a bioidentical form called Armour Thyroid.
What's the difference?
Well, it's a great question. Armour Thyroid is derived from porcine, or from the pig, and it's a combination of the two active thyroid hormones, T3 and T4, in the same percentage or ratio that your body normally makes, where Synthroid is 100% T4. You might say, well, Dr. Wycoff, it's only 20% difference. Well, that 20% makes a big difference in how your body recognizes and uses the thyroid hormone. So frequently we have patients that we see at the Wycoff Wellness Center that are on synthetic thyroid, Synthroid, Levothyroid, Unithyroid, and they're saying, listen, my symptoms just really haven't gotten better. I'm sure I have low thyroid. My tests show that. My symptoms seem to indicate that, but the medication doesn't seem to really help. And when we put them on a bioidentical form of thyroid replacement, Armour Thyroid, or a compounded thyroid preparation we can have prepared for them, magically their symptoms start to improve.
You say magically. It's because you've diagnosed it and you've treated it. How long will it take till you start to feel better?
It's a great question. Oftentimes when you get on that right thyroid preparation, you'll notice changes within just a few days. Your energy will start to improve. You'll find that your skin is getting moist. You'll start to see hair regrowth. You'll start to sleep better. Your mood will lift. And then for most of us, if we're really struggling with weight, we'll start to see our weight begin to come down. And that's a powerful thing. If you feel good, you're much more motivated to do the things that you really need to do to take charge of your life. And then we support it with the right nutrients. Like I said earlier, we try to make sure we have enough iodine intake, enough zinc, vitamin D. And then for men and women, hormonal imbalance, especially for people in our age and women in over 30, they tend to have some imbalance of those female hormones, which affects thyroid function. So we want to get those hormones balanced, and if we have to do that, the Wycoff Wellness Center, we approach it in a way and use bioidentical hormone replacement to get you that optimal place so you can restore health and wellness naturally.
There's a pathway to feeling good, and it's through Dr. Wycoff. Thank you very much this morning.
Thank you, Michael.
Appreciate that.